Why nighttime blood pressure is more dangerous than you think. Most of us assume that sleep is when our bodies finally relax, that our heart, like the rest of us, gets a break. But for millions of people over 55, something entirely different is happening. While you're lying peacefully in bed, your blood vessels might be under silent pressure, like a garden hose left on overnight, building force, inch by inch, until it bursts. Doctors call it nocturnal hypertension, a condition where your blood pressure rises at night instead of dropping, as it's supposed to. You see, in a healthy body, blood pressure naturally dips by about 10 to 20% when we sleep. It's nature's way of giving the heart a rest. But for some people, especially older adults, this dip doesn't happen. This is called the non-dipping pattern, and it's far more dangerous than most realize. Studies show that people with non-dipping blood pressure patterns are at significantly higher risk of stroke, especially early morning strokes, heart attacks during sleep or shortly after waking, kidney damage, even cognitive decline over time. And the scariest part? Most people with nighttime high blood pressure have no symptoms at all. It doesn't cause pain, it doesn't wake you up. Until one day, it does. Your body isn't resting, it's wrestling against gravity, against poor posture, against shallow breathing. Your heart becomes like a lighthouse in a storm, flickering, overworked, and trying to guide you safely through the night. So if you've ever said, "But my blood pressure's always fine at the doctor's office," think again. That one reading during the day may not tell you the whole story. Coming up, I'll show you the 3 specific sleeping positions that could change your nighttime numbers, and why position number 1 may be the simplest blood pressure fix you've never tried. Stick around, because the way you sleep tonight might be just as important as what you eat tomorrow. Now that you understand how dangerous nighttime blood pressure can be, here's something even more surprising. The way you sleep, your favorite cozy, familiar position, might be secretly making it worse. You see, posture isn't just about how you sit or stand during the day. When you lie down for the night, your body enters a new relationship with gravity. And depending on your sleeping position, you're either helping your blood flow freely or you're squeezing your arteries like a slow, silent vice. Let's walk through the 3 most common sleeping mistakes that can elevate blood pressure in your sleep without you even realizing it. Mistake number 1, sleeping flat on your back without support. This position may feel natural, but here's the problem. When you lie flat, your tongue and soft tissues can fall backward, partially blocking your airway, especially if you snore or have mild sleep apnea. This forces your body to work harder for oxygen, increasing your heart rate and blood pressure. Imagine trying to sip through a pinched straw all night long. That's what your heart is doing in this position. Mistake number 2, sleeping on your stomach. It might reduce snoring, but stomach sleeping is a cardiovascular mess. Your neck is twisted, your spine is misaligned, and your chest and abdomen are compressed. This posture restricts lung expansion and puts pressure on major arteries, leading to poor circulation and nighttime stress on your heart. Think of it like sleeping with a sandbag on your chest. Your heart has to pump against extra resistance for hours. Mistake number 3, left side sleeping without alignment. Now, sleeping on your left side can be beneficial for digestion, but without proper support, it may stress the heart, especially in those with congestive heart issues. If your upper leg collapses forward or your shoulder caves in, it twists your chest and can impede circulation. Without the right pillow support, even a healthy position can work against you. So what should you do? In just a moment, I'll reveal the first of 3 sleep positions designed to help lower your blood pressure naturally while you sleep, backed by science and used by many heart specialists themselves. And no, It doesn't involve fancy equipment or expensive gadgets. Just a small change that could make a big difference, starting tonight. Let's begin with the simplest one, the pressure-relieving position most people overlook. If your heart could choose a sleeping position, it would whisper, "Lie on your right side and let me rest." Because among all the ways you can sleep, right side sleeping is like a gentle hug for your heart. It's not dramatic, it's not trendy, but it works. Why right side sleeping helps lower blood pressure. When you lie on your right side, you're doing a few powerful things all at once. You relieve pressure on your heart. Your heart sits slightly to the left of your chest. Sleeping on your right shifts the gravitational load away from your heart, giving it space to beat more freely, more gently. You improve blood flow. This position encourages better venous return, your body's way of sending used blood back to the heart. It's like opening up a traffic lane that's usually jammed. You activate your parasympathetic nervous system. That's your rest and repair system. Right-side sleeping has been shown to increase vagal tone, a fancy term for the nerve signals that slow your heart rate and blood pressure at night. The research behind it. A 2019 study, published in the Journal of Clinical Hypertension, found that patients who slept on their right side had significantly lower nighttime blood pressure compared to other positions. And in another sleep lab trial, participants who switched from back sleeping to right side sleeping experienced fewer heart rate spikes during REM sleep, meaning their hearts stayed calmer during dreams and subconscious activity. How to sleep on your right side correctly. Not all side sleeping is equal. To get the full benefit, you want a firm pillow to support your head and keep your neck aligned. A pillow between your knees to reduce pressure on your hips and spine. Optional, a small pillow or towel behind your back to prevent rolling onto your back during the night. These adjustments may seem small, but for your circulation, it's like turning down the volume on a noisy radio, so your heart can finally relax. Tonight, try this. Before bed, lie on your right side. Place a pillow between your knees. Take 4 deep breaths and just listen to your body. Can you feel your chest loosen, your shoulders drop, your heartbeat slow? Let us know in the comments tomorrow how it felt. One position, one night. It could change everything. And if right-side sleeping isn't ideal for you, maybe you snore, have acid reflux, or deal with sleep apnea, don't worry, because the next position might be exactly what your body has been waiting for. Let's talk about elevated sleeping and why it could be your new best friend. Imagine you're trying to row a boat upstream while the current pushes against you. That's what your heart does every night. If you lie flat and suffer from issues like snoring, acid reflux, or sleep apnea, it fights gravity, it struggles to pump, and your blood pressure climbs silently in the dark. But what if you could let gravity help instead of hurt? That's exactly what sleeping with your upper body slightly elevated can do. Why elevated sleeping supports lower blood pressure. Raising your upper body by just 10 to 30 degrees can have surprising effects on your cardiovascular system, especially at night. Here's how it helps. 1. Opens your airway. Elevating your torso prevents your tongue and throat muscles from collapsing backward, a common cause of sleep apnea, which spikes nighttime blood pressure due to oxygen deprivation. 1. Reduces nighttime reflux, GERD. For those with acid reflux, lying flat allows stomach acid to creep upward, disturbing sleep and stimulating stress hormones like cortisol, which can raise BP. With elevation, gravity keeps acid where it belongs. 1. Relieves pressure on the heart. Elevating the upper chest reduces fluid retention in the lungs and legs, making it easier for the heart to pump efficiently throughout the night. Think of it as putting your heart on a gentle slope, so blood flows smoothly downhill instead of forcing its way upward. Science behind it. Studies on patients with obstructive sleep apnea, a key contributor to hypertension, show that sleeping at an incline improves oxygen flow and reduces sympathetic nervous system overactivation, which is what causes nighttime spikes in blood pressure. Even those without diagnosed apnea report better heart rate variability, fewer nighttime awakenings, and lower morning BP when sleeping on an incline. How to do it at home. No fancy bed needed. You don't need a hospital bed or expensive equipment. Here are 3 easy options. Use a wedge pillow, found online or at most sleep stores. Ideal angle 15 to 30 degrees. 1. Raise the head of your bed. Place books, bricks, or risers under the top legs of your bed frame. 1. Our towel method. Roll 2 to 3 thick towels under your regular pillow to create a gentle slope. In intention, don't just elevate your head, lift from your waist up to avoid neck strain and ensure full body benefit. If you've ever woken up gasping for air, or felt a burning in your chest in the middle of the night, or had your morning blood pressure shoot through the roof, try sleeping on an incline tonight. It might be the missing piece between a restless night and a restorative one. And don't go anywhere, because the next position might surprise you. It's rarely talked about, but it can soothe your nervous system and ease your heart, especially if done with one simple tool: a body pillow. Let's explore position number 3. There's something comforting about lying on your side, curling up slightly, and feeling your body let go. But when you sleep on your left side the right way, something powerful happens, not just emotionally, but physiologically. It's like giving your heart a hug from the inside out. Why left side sleeping with support can help lower blood pressure. While the heart is slightly left of center in your chest, sleeping on your left side with proper support has been linked to enhanced vagus nerve activation. Your vagus nerve controls the rest and digest system. Lying on your left side may stimulate this calming pathway, helping to slow your heart rate and reduce nighttime blood pressure. Improved lymphatic drainage. The majority of your lymphatic system drains toward the left side of your body. Left side sleeping helps clear fluid retention, reducing the burden on your circulatory system. Better digestion and organ alignment. Gravity helps your stomach and pancreas function more efficiently when you lie on your left, leading to fewer overnight stress signals and a more relaxed cardiovascular system. But here's the secret: it only works if you do it correctly. The role of proper support. Body pillows to the rescue. Without support, sleeping on your left can collapse your shoulder, twist your hips, and compress your chest, undoing the benefits. That's why we recommend using a full-length body pillow. This one tool keeps your top leg from pulling your spine out of alignment, prevents your chest from rotating forward, supports your arm and shoulder so you don't wake up sore or tense. It's not just about comfort. It's about maintaining open circulation pathways all night long. Think of the body pillow as a pressure valve, gently holding your body in perfect balance while you rest. Who should avoid left side sleeping? If you have advanced heart failure or certain valve conditions, left side sleeping may put mild pressure on the heart. Always check with your doctor if you've been diagnosed with serious heart disease. But for most seniors with mild hypertension, digestive issues, or poor sleep, this position can bring quiet relief. Try this tonight. Lie on your left side. Place a body pillow or firm pillow between your knees. Hug it gently with your upper arm. Take 5 slow breaths. Feel your shoulders melt. Feel your chest soften. That's not just relaxation. That's your blood pressure responding in real time. And now that you've learned the top 3 sleeping positions, let's look at what else might be happening around you. Now that you've learned the best positions to sleep in, let's talk about what's happening around you, because even the perfect sleeping posture can't lower your blood pressure if your environment and bedtime habits are working against you. Think of your bedroom as your personal healing sanctuary. If your bed is the boat, then the room is the ocean. Calm waters equals a calm heart. So how do you create that kind of space? Here are 3 nighttime habits that work with your body, not against it, to support naturally lower blood pressure at night. 1. Practice slow, rhythmic breathing. 4-7-8 method. Before you even close your eyes, take a moment to reset your nervous system. Inhale gently for 4 seconds, hold your breath for 7 seconds, and exhale slowly for 8 seconds. Repeat 4 to 5 cycles. This isn't just relaxation, it's a neurological reset. Deep, slow breathing activates the parasympathetic nervous system, signaling your heart to slow down, your blood vessels to relax, and your mind to let go. You're not just breathing, you're whispering to your blood pressure, it's safe to rest. 2. Cool your room down, ideal 65 to 70 degrees Fahrenheit. Your body's core temperature needs to drop slightly in order to fall asleep and stay asleep. A cooler room doesn't just help you fall asleep faster, it also supports melatonin production, reduces nighttime cortisol, and helps stabilize blood pressure through the night. Think of it like putting your heart in a gentle refrigerator, not too cold, just enough to preserve peace. 3. Unplug from screens 1 hour before bed. Blue light from phones and TVs tells your brain it's still daytime, blocking melatonin, raising alertness, and keeping your heart in go mode. Try replacing screen time with soft music, a warm bath, journaling or reading, or even a few minutes of stretching while lying in your sleep position. Your heart doesn't need more stimulation at 10 p.m. It needs rhythm, stillness, simplicity. A simple bedtime routine for seniors. Here's a gentle routine you can try tonight. 9 p.m. No more screens. 9:15 p.m. Warm herbal tea. Try hibiscus or chamomile. 9:30 p.m. 4-7-8 breathing in bed. 10 p.m. Lie on your right side, pillow between knees, room cool and quiet. This is your invitation to rest, not just sleep. But what happens if you wake up in the middle of the night with a pounding chest or racing mind? Let's talk about what to do in that exact moment to bring your blood pressure back down safely and naturally. It's 2:17 a.m. You're lying in the dark. Your heart is racing. You feel a strange pressure in your chest, maybe even a wave of anxiety. First of all, you're not alone. And second, you are not in danger. Your body is just asking for help, and you can give it right now. Here's what to do when you wake up in the night with high blood pressure symptoms, no medication required. Step 1. Sit up and breathe. Use the 4-4-6 method. Inhale slowly through your nose for 4 seconds. Hold for 4 seconds. Exhale through pursed lips for 6 seconds. Repeat for at least 5 rounds. This slows your heart rate, activates your calming nervous system, and begins lowering pressure. Step 2. Sip cool water. Just a few sips can rehydrate your system, activate the swallowing reflex, which triggers vagus nerve response, help reduce cortisol, your stress hormone. Step 3. Gentle movement. Stand up slowly. Do 1 to 2 minutes of shoulder rolls, neck stretches, marching gently in place. These micro-movements distribute blood flow, relieve vessel tension, and reduce the risk of a sudden BP surge. What not to do. Don't check your phone. Don't turn on bright lights. Don't panic. Your body isn't failing, it's signaling, and now you know how to listen. If you've ever experienced this, share your story in the comments. What calms you down? Your advice might help someone else sleep through the storm. And now that you've seen the best positions, bedtime habits, and middle-of-the-night strategies, let's bring it all together in a simple blueprint you can follow starting tonight. Coming up next, your bedtime blood pressure plan, from pillow to peace. Let's take a step back. You now know that blood pressure doesn't rest when you do, unless you help it. And the way to do that isn't complicated. It doesn't require new medications or pricey gadgets. It just takes a little intention and the right routine. So here's your simple bedtime blueprint, a step-by-step guide to sleeping in a way that protects your heart, calms your nervous system, and gently lowers your blood pressure while you rest. Step 1. Choose your position wisely. Right side sleeping, the default for most seniors. Elevated upper body, great for sleep apnea, reflux, or snoring. Left side with support, ideal for lymphatic drainage and vagal tone. Use a body pillow. Each of these positions reduces cardiovascular strain, like turning the dial down on your internal pressure valve. Step 2. Calm the body before bed. Practice 4-7-8 breathing. Dim the lights. Drink a warm, caffeine-free tea. Try hibiscus or chamomile. This sends a clear message to your body. It's time to rest, not just sleep, but truly heal. Step 3. Create the right environment. Keep your room cool, to 65 to 70 degrees Fahrenheit. Turn off all screens 1 hour before bed. Use blackout curtains or a sleep mask to eliminate light. Because when your environment is calm, your nervous system follows. Step 4. Stick with it. This isn't about one perfect night. It's about small steps, repeated. One night of deeper sleep leads to one better morning, which leads to a healthier, stronger you. Think of your bedtime as landing a plane. You don't slam it down. You glide in gently, in the right position, with the right rhythm. And your heart? It lands with you, safe, steady, and supported. Next up, a powerful invitation that just might change your nights forever. Tonight, you have a choice. You can go to bed the same way you always have, hoping your heart gets the rest it needs, or you can take control with something as simple as your sleeping position. Because now, you know what your doctor may never have told you, that blood pressure doesn't sleep just because you do, that the way you lie down can turn your bed into medicine, and that peace, healing, and heart health are not just found in a pill bottle, but in the small, intentional choices you make each night. So here's your gentle challenge. Pick one position tonight. Try right side sleeping, or elevate your chest, or use a body pillow on your left. Just start. And tomorrow morning, check in with yourself. How did you sleep? How did you feel? Did your numbers shift? Then come back and let us know in the comments. When you share, you're not just helping yourself, you're helping someone else find peace too. If this video helped you, tap like, share your favorite tip or position in the comments, subscribe, and turn on notifications so you never miss another step on your journey to better blood pressure. Send this to a friend or family member who needs restful sleep and a healthier heart. You deserve nights that heal, not harm. You deserve a heart that rests as deeply as you do. You deserve peace, and it all begins tonight.